Hello and welcome to Health Horizon with Pushpa, the podcast where we bring you expert insight on essential health topic. I am your host Pushpa Adhikari, a public health professional with a Master of Science in Public Health, specialized in epidemiology from Kathmandu University of Medical Science. My background is in nursing and I am very passionate about evidence-based health discussion. I am especially excited about today's episode as it marks the launch of our very first podcast. We begin with a critical health challenge and timely topic today, that is obesity and weight management. To provide in-depth insight into this important issue, we are honored to have with us Assistant Professor Dr. Srinarayan Yadav, Senior Consultant Physician and a leading expert in internal medicine and a metabolic disorder. Dr. Yadav will help us explore the science behind the obesity, its associated health risks, and the most effective evidence-based strategy for weight management. Dr. Yadav, welcome to Health Horizon with Pushpa podcast.
Thank you very much. I'm very excited to talk about this critical health important topic, that is obesity and weight management.
Okay, moving on, Dr. Yadav, many people think of obesity as simply carrying extra weight. Could you explain what obesity actually is from medical perspective?
So, from the medical perspective, I would like to say that obesity is not just excess weight. Rather, it is a chronic disease which is characterized by deposition of the excessive fat. Deposition in the form of the site around the abdomen, that is a visceral fat, or elsewhere. It is a distribution of the fat. And typically obesity is classified on the basis of the ethnicity basis. In the Asian, body mass index when more than 25 to 30, it is classified in the obesity class 1, and 30 to 35 obesity class 2, more than 35 class 3 in the in the case of the ASEAN. But when in the form of WHO classification, obesity is known as when BMI is more than 30. So there is a technically something different, but I would like to say that it is not just about the BMI. Rather, it would better to say that distribution of the fat. And important aspect is obesity is it's a disease which carries a risk factor for the various metabolic, cardiovascular, neurological, psychological diseases. So important topic to discuss here, and it is very interesting.
Oh, that interesting. So, what causes obesity? Is it just about eating too much and exercising too little?
So to talk about the causes of the obesity, so if it is written, it is a multifactorial. That is a combination of the genetics, hormonal, environmental, and behavioral. So genetics, talking about the genetics, there is certain genes, there is a certain chromosome, there is a certain genetic factor which directly indirectly affect our body, how we store the fat, how we regulate the appetite, and these all are directly indirectly linked with the epigenetics. So genetics and epigenetics are important factor. Talking about the hormonal, so there are the hormonal imbalances in the form of the leptin, so that regulate the hunger, and condition like the leptin resistance leading to persistent overeating. And another aspect is inflammation and the metabolism. In the obesity, there is a chronic low-grade inflammation that increase the contribute to the insulin resistance and leading to the risk of the diabetes. Another sedentary behavioral and high-calorie diet, low-fiber diet, refined sugar, processing food, poor sleep pattern, all directly indirectly play the role developing the obesity. So in short, we can say that obesity is not a single factorial disease, rather it is a network, it is a multifactorial, and multifactorial in the combination of the genetics, hormonal, and environmental.
Okay, talking on the health risks of obesity. Obesity is linked to many health conditions. Could you elaborate on the most serious risk?
Obviously, obesity is a significant. I'm already saying significant increase the risk of the various critical important health related factor in the form of the cardiovascular, EMI, myocardial infarction, dyslipidemia, and I would like to say that in the form of the percentage, 3% population have the cause factor of the obesity in the form of the stroke. 3.5% the congestive heart failure, 8% have the ischemic heart disease, and PCOS, polycystic ovarian disease, major depression, diabetes, so NAFLD भनेको non-alcoholic fatty disease, obstructive sleep apnea, neo osteoarthritis. These all are associated with the obesity. So obesity is a important it's important risk factor for developing such type of the fatal disease. Important factor I would like to say that it is one of the important risk factor for developing the cancer. In the cancer, talking about the cancer, in the cancer, in the breast cancer, and colon cancer, pancreatic cancer, and liver cancer. These are the due to the increased inflammation and hormonal balances. These cancers are the very much prevalence in the person having the obese, having the BMI more than 30 or 25 in the Asian continent, and sleep obstructive sleep apnea. These are also associated with the sleep. So these are the diseases, these are the condition, these are the social factor. So all are directly indirectly linked with the obesity.
Managing obesity is very challenging. So, can be the most effective evidence based strategy for sustainable weight loss?
When we talk about the significant weight loss or sustainable obese management, there are the various approach in the form of the pharmacological, in the form of the non-pharmacological that lead to the significant weight loss. In the form of the non-pharmacological approach, so lifestyle modification in the form of the exercise, exercise 130 to 150 to 300 minutes daily, moderate exercise, and and the balanced diet. And balanced diet means we have to take the low carbohydrate rich diet and more proteinous diet, and there is a we have to avoid the ultra processed food in the machinery, refined sugar, unhealthy fats, trans fat. We have to avoid it, totally avoid it. It's crucial for maintaining the weight. And the form of the in the form of the pharmacological, one of the important and exciting treatment is a GLP receptor agonist in the form of the liraglutide, semaglutide, which is the appetite regulator. It has shown that in the evidence-based medicine that it's a 15 to 25% weight loss due to the GLP receptor agonist. And another important is one of the topiramide, which is used in the migraine. Is also important aspect of the controlling the obesity. Orlistat is also shown that the 12-month weight loss, the 4 to 5% is shown that the weight loss is very significant person having taking the orlistat. So these are the pharmacological aspect of the obesity management. Another surgery, talking about the surgery, bariatric surgery, but indication when there is a severe obesity, that BMI more than 40 or BMI more than 35 with comorbidities, bariatric surgery is a gold standard. And another is gastric bypass and sleep gastrectomy will lead to 40 to 30% excessive weight loss, and that also limits the type 2 diabetes in nearly 80% of the cases. One of the side effect of this surgery is after the surgery there is again possibility of the chance of the regaining the weight. So these are the, in short, we have to say that pharmacological, non-pharmacological, surgical aspect. When you combine all these three aspects, we can get the significant obesity management and weight loss.
Now, talking on the future of obesity treatment, where is obesity treatment headed in the future?
So, if you talk about the obesity management in the form, I mean, in the futuristic aspect, so futuristic aspect is a personalized obesity medicine. So, dual, triple hormonal therapy, microbiome research, molecule, and wearable technology, AI-based coaching. These all are the futuristic aspect of the obesity management.
Okay, now we are at the end, Dr. Yadav. Before we wrap up, what are your key takeaway messages for our listeners?
So, key message I would like to convey is obesity is a complex disease. It is not just a lifestyle choice. It's a combination of the pharmacological, non-pharmacological, and surgical may be needed for the effective weight management. Even modest weight management can be done to significant improve the health outcome in the form of the cardiovascular outcome, metabolic outcome, and cancer. Colon cancer can be the significantly reduced with the help of the weight management. And long-term success depend on the sustainable habit, not the quick fixes. And person have to take the this pharmacological therapy medicine long time, and doctor also has to do the more and more counseling to initiate the treatment and to continue the treatment and better the patient have to take the lifestyle modification and take the drug at the time regular basis, and has to visit the doctor on the regularly to improve the significant weight loss and successful obesity management.
Thank you so much, Dr. Yadav, for sharing your valuable insight and helping us for better understand obesity and weight management. Your expertise has truly been enlightening. Thank you so much.
So I am very happy to talk, very exciting talk obesity and weight management. I hope please disseminate this podcast in our society and community to impact a helpful in our public health.
And to all our listeners, I hope you found this episode informative and helpful. If you did, don't forget to like, share, and subscribe to Health Horizon with Pushpa for more insightful conversation on health and well-being. Until next time, stay inspired, empowered, and most importantly, take care of your health. Take care. Bye.